Well, there is now this new tool to fight COVID. Cold season may have just gotten a bit trickier because today an FDA advisory panel says the leading over-the-counter decongestants used by millions of people, they don't actually work. The drug in question is phenylephrine, which is found in versions of Dayquil, Sudafed, Benadryl, and Mucinex. FDA advisors reviewed recent studies and came to the conclusion that when taken by mouth, basically these are usually pills, right? Only a tiny amount of phenylephrine actually reaches the nose to relieve congestion. We spoke with a pharmacy professor from UC San Diego who's on that FDA advisory panel. She told us about her concerns.
For consumers, if they're using this drug specifically for nasal decongestant, it's not going to work. And there's robust, convincing data, clinical data that demonstrate that. Talk to your healthcare provider, talk to your pharmacist of what the options are. If you really want to move forward with medication, there are options out there.
So you may be wondering why the change and why now? Well, Dr. Lay says the same panel met on this issue back in 2007, but agreed that additional research was needed. She says since then, clinical trials have improved quite a bit.
You know, we've gotten so much better with how we conduct clinical trials. And the clinical parameter that we use in the more recent trial is really indicative of what I would think consumers want. Is their symptoms improving? That was not the metric that was used in older studies. We should be continuing to do this, continue to look at drugs that from not only the safety, but also the efficacy standpoint.
So if the FDA follows through on the panel's recommendations, drug makers could be required to pull their medications containing phenylephrine from store shelves. Dr. Lay says the panel did not review the data on nasal sprays that contain phenylephrine.